Good morning. This is Mohammed Sadat, student in epidemiology at UNTHSC School of Public Health, and I'm recording a presentation for chronic epi class, epi 5318 on type 2 diabetes mellitus and effects of hypoglycemic states caused due to treatment of type 2 diabetes. So in the chronic report that was submitted, these are the topics that I covered: significance, pathophysiology, the disease, descriptive epidemiology, risk factors, prevention, treatment, and areas of future research. So this presentation just focuses on a subset of the entire report, and which is the treatment, a study that focused on treatment and its impact on patients for type 2 diabetes mellitus. The study was titled Effect of Hypoglycemia on Brain Structure in People with Type 2 Diabetes. The authors are Z. Zhang, James Lovato, and others, and this study was published in Diabetes Care, volume 37 in December of 2014. The purpose of this study was to discover or to find out, is symptomatic severe hypoglycemia associated with brain atrophy? This hypoglycemia results because of intense and strict management of glucose levels in the blood. So because of this, due to intensive treatment of diabetes, hypoglycemia or low sugar in blood is a common consequence. Hypoglycemia has been linked to irreversible damage like coma, cognitive decline, and dementia. So they wanted to figure out, is there a link between treatment of diabetes in this intense manner and these potentially devastating outcomes linked to hypoglycemia? Now let's talk about research design and methods. This study that the authors did, it's part of a well-known study on the effects of diabetes on the brain, and it's called Action to Control Cardiovascular Risk in Diabetes, ACCORD, and Memory in Diabetes Trial, MIND. So these are two studies combined together. The ACCORD MIND study was conducted in 51 clinical sites in North America, and there are two studies occurring here. The ACCORD study is a randomized trial of standard compared to experimental groups, and then in that study, the experimental group consisted of those with intensive management of hyperglycemia in people with type 2 diabetes. The population was between 45 to 79 years of age, and the inclusion criteria was participants with the disease, and 503 participants were selected. The study type was a cohort analysis of the MIND study participants, and which is a subset of the larger ACCORD study. So like I said, it's a cohort analysis of the study participants. The exposure was symptomatic severe hypoglycemia induced by treatment, and it's defined, the authors defined it as a blood glucose of less than 2.8 millimoles per liter, and the symptoms requiring assistance of another person or any form of medical assistance to deal with this hypoglycemia. The outcome as measured by baseline and 40-month standardized brain MRIs was total brain volume changes, abnormal white matter volume changes, and brain scans that were reviewed for local disease. These volume changes, the means of the outcome volume changes over the 40-month study time would be compared between the group of participants that had the exposure and those that did not. Now here's a brief overview of analysis. The measures of frequency that the authors used were incidence rate, and prevalence, and the measures of association that the authors used were mean differences, risk and rate ratios, confidence intervals, as we'll see later on. The statistical tests that they used were the Mann-Whitney-Wilcoxon rank sum test and the chi-square test when they were comparing two categories. The confounders that they controlled for were basically general confounders that a lot of epidemiologists control for: demographic and anthropometric characteristics like age, sex, ethnicity, education level, BMI, and also they controlled for some laboratory measures like serum creatinine levels, LDL, HDL cholesterol levels, the medication used, and clinical measures, and also they controlled and treated as a potential confounder the severity of the diabetes that the patient or the study participant may have. Here are the results. 28 of the 503 type 2 diabetes mellitus participants had at least one hypoglycemic episode or the exposure during the 40-month follow-up. And what they discovered was that there was no significant increase in outcomes in participants with the exposure. So compared with participants without the hypoglycemic event and those with the hypoglycemic event, uh, there was not much difference. As far as total brain volume is concerned, they had marginally significant less atrophy. And so those participants with the exposure, the hypoglycemic event, the mean difference in the volume changes for total brain volume was 9.55. And then those without the hypoglycemic event, it was 15.38. And you see the p-value there. And the authors concluded that there was not much difference between these two groups, as you can see by the confidence interval. Now, as far as the abnormal white matter volume changes, there was no significant increase. And that with the hypoglycemic event, it was 2.06. Without, it's 1.84. Now, the key difference between these two results is that for the total brain volume, you're looking at the mean volume difference during that 40-month time period. But for the abnormal white matter volume, these are the ratios of change, the 2.06 versus 1.84 in the two groups that are being compared. And then also, there were no unexpected local signal changes or volume loss observed in MRI brain scans. When they did the MRI, they did not see major difference between the two types of groups. The conclusion that they arrived at was that hypoglycemia related to type 2 diabetes mellitus treatment may not accentuate brain pathology, specifically brain atrophy or white matter abnormalities. Some limitations of the study. The abnormal white matter volume change results had a p-value of 0.247. This is higher than the standard accepted value of 0.05 or 5% chance of type 1 error. There were only 28 hypoglycemic events and the exposures during the time frame of the study. This limits the power of the study. So they would just need to conduct a study on a larger scale with more exposures and increase the power of the study to gain stronger results in the future. The loss to follow-up did occur. Loss to follow-up did occur as every patient did not have a 40-month follow-up MRI scan. And other patients, on the overall scale, this was not the case with every patient. There were a few that were lost to follow-up. But even if there are a few, this limitation has to be counteracted by using a multiple imputation procedure. And they did use that to address this limitation, but that reduces the power of the study. So there was some loss to follow-up over the 40-month follow-up period. The strengths of the study. This was the largest ever MRI study of brain structural changes in hypoglycemic type 2 diabetes patients, and it demonstrates the resilience of the brain undergoing this kind of a hypoglycemic state. Let's just briefly look at the Belmont report as it impacts this study. The first main principle is, of course, respect, protecting the autonomy of all people and treating them with courtesy and respect and allowing for informed consent. And they did that. And Accord Mind Study is a well-known, respected study. And of course, they would allow for informed consent, and the participants could leave any time that they desired to do so from the study. The second principle is beneficence, which is do no harm. And you want to maximize the benefits for the research project and minimize the risk to the research subjects. And they demonstrated that because while they're doing this large study, intensive glycemic control intervention of the Accord trial was stopped early because this study arm had a higher mortality. So when they saw that it was harming the research subjects and they wanted to minimize the risks, so then they stopped this particular study arm. The last principle I wanted to look at was justice, ensuring reasonable, non-exploitative and well-considered procedures are administered fairly, and there's a fair distribution of costs and benefits to potential research participants equally, and they did manage that in this study. Some of the implications of the study is that the key finding was that severe symptomatic hypoglycemic events in treated type 2 diabetes mellitus patients are not associated with brain damage. Specifically, they're not associated with three things: loss of total brain volume, they don't have an increase in abnormal white matter volume, and they don't see any pathological changes in brain morphology as measured by MRS. So the implication is that brain is surprisingly resilient to hypoglycemic states, especially hypoglycemic states induced by treatment of type 2 diabetes. So what this could imply is that more aggressive management of hyperglycemia could be pursued, and you would get some benefit from that. Study also discovered that hypoglycemic events are more likely to occur in older patients who had insulin, being treated with insulin, uh, that they were under intensive glycemic control, they had the disease, type 2 diabetes, for a longer time, and more neuropathy and more visual acute, more worse or worse visual acuity scores were seen. So again, this was just a look at the treatment aspect or the effects of treatment for those dealing with this disease. Here are my references, and thank you for listening.